Hi, hi everyone. Thanks for joining me again tonight for our weekly Facebook Live session. I'm Debbie Forward, RNU president, and I am delighted that you could join me this evening. I'd like to start off tonight on a pretty sad note, as I'd like to honor and remember the 22 victims of the just senseless tragedy that occurred in Nova Scotia on the weekend. I know we are all still coming to grips with what happened, and I'm not sure we'll ever come to grips with what happened. And it's important for us to honor and remember the victims, their families, and the devastation that every single person in Nova Scotia and really across the country feel. Tonight I'm wearing blue in honor of the 22 victims. Last night I tied some Nova Scotia tartan around one of my posts outside as a visible sign of remembrance. I'd in particular like to honor one victim, and that is an LPN. Her name is Heather O'Brien. She worked for VON in Nova Scotia for many years, and the tributes that I've read about her online, talked about her being happy, caring, loved her job. Sounds like every nurse I know. And I know that her VON family are just devastated. I sent our condolences and support to Janet Hazelton, who's the president of the Nova Scotia Nurses Union. Heather was a member of her union. So all of her members are grieving right now, as are all Nova Scotians. So it's hard just to keep going sometimes, but it's important for us to take that second and that minute to remember. So before I start, I would like to just take a few moments just to honor and remember those 22 people and send lots of love and support to their grieving family and friends. Thank you for joining me in that. It means a lot. This is also a special week and a positive week, and even in the middle of all this turmoil and sadness, there are always and still things to celebrate. We learn very quickly, and we know as registered nurses and nurse practitioners that, 1 minute we can be gripped with sadness, and the next minute in our work lives, we can experience joy. And get pretty good at being able to go from one emotion to another because that's the type of environment that we work in. So this is also a week to recognize our volunteers. And I'd like to do a shout out to our new volunteers tonight, our branch executive people, our shop stewards, the many people who participate in committees. No matter what you do, the RNs that support other RNs, thank you very much for giving of yourself and being part of this wonderful union. And we wouldn't be able to do the great things that we do without the support of our volunteers. So thank you very much on behalf of your board of directors and every single RN in the province. I'd like to also give a shout out to those RNs who volunteer in your communities. And I know there's so many ways that you do that, whether it's helping out with a soccer team or a hockey team or gymnastics or guides or brownies, or even, doing volunteer work in other ways with disadvantaged people. So giving back to your community is very important. So I salute you tonight as well. And thank you very much for all that you do. So this is my opportunity to answer your questions. And I'd like to get right to that now. There were a number that I missed from last week, and wouldn't you know that I've now figured out that you have to scroll down on the Facebook feed to see the questions. Yep, it takes every. I learn something new every week I do this, so that was my learning from last week. And but before I get, and I'm scrolling now and seeing all the people that are watching, which is really, really great. I'd like to go back to a couple of questions from last week that I actually missed. So one is around, and I've heard this, it's not as much of a question, I guess, as it is a concern. And it's coming from those RNs who are working in areas where they haven't been able to downsize, where their occupancy rate is still very high and acuity is still really high. And they're just slogging it out every day, just as if it was a normal day. And that is really difficult when they look around them and they see other units with low occupancy. They see some RNs being sent home because of trying to decrease the number of people that are in the facility. So practicing the physical distancing, but there they are working hard every single day. And I want to acknowledge that tough work that you're doing. And, someone said we're all in the same boat, and we sort of are, but some boats are shaped differently than others. And we have to acknowledge that some people have it's for medicine units, and I want to throw in there as well our long-term care facilities, and they haven't been able to decrease their occupancy, so they're still going, full out, as well as our community health RNs, in the community. I mean, they were the first ones that really saw the increase in number of patients and the testing and having to do home visits and following people in homes and the contact tracing. And so many areas have tremendous increases in workload, while we see some areas that have decreases in workload. And we have to be supportive of, and I think as RNs, it's important that we acknowledge every single one, and we do what we can to support every RN. Yes, some have it great. I guess you might look at that and that they get to go home, and others are working really tough. So it's important that the ones who get to go home, make sure you take that extra bit of time to say thank you to those who don't have the luxury of seeing their occupancy decreased. These people are starting to feel very burnt out and tired, and they're concerned about if a surge comes or when the surge comes. Are they going to be ready and rested and ready to take on that surge? Because they'll be just a part of that, like the RNs who might be working in Emerge or the COVID unit or ICU. We'll all have a role to play around that. I can tell you that I did talk to Eastern Health in particular, but raised this with all employers. I talked to Eastern Health about this on Friday, and we raised it with all employers during our provincial meeting on Tuesday, to see if there's specific actions that they can take to support areas that aren't seeing the benefit of decrease in occupancy rates. What can be done to try to give those RNs a little bit of a break as well? I'll follow up tomorrow. We're having another meeting tomorrow, and we'll follow up with that. I heard through grapevine that, it might have been a slightly better weekend on medicine, in particular at the health sciences this past weekend. But we'll keep pushing the employer not to forget every single worker within their facility. And everyone is carrying a burden of some sort, and we need to support everyone collectively. So I apologize too for those RNs for missing that question last week, and I hope tonight me speaking about it sends a message that we are concerned, and we're trying to work with the employer to improve the situation for you. Another member, Tina, asked a question last week as well around, can our schedule be changed? And can I be just scheduled overtime without being notified? So a couple of things around this. First of all, if your schedule is changed, you should be notified. If your employer should give you some notice around that your schedule is going to be changed. In terms of the overtime, while we have a good neighbor agreement in place, it doesn't mean that the employer shouldn't follow the what I call sort of the rules around um, mandatory overtime, and that they, first have to go to those who are willing to do overtime to see if anybody who wants to do it. And once they've gone through that list, then they can start. They have to make sure they go through the list before they mandate someone. So none of that has changed with the Good Neighbor Agreement. So the provisions around overtime are still the same, even during COVID-19. They can, certainly change your schedule, and they might not ask for your permission around that. And that happens pre-COVID, without COVID as well, that your schedule can be changed. But I would expect them to let you know that it is changed. Nadine had a really good question around. We know that all of the support mechanisms like chiropractor, massage, physio, all those places had to be shut down because of the social distancing. And no one knows better than me the impact of that, because one of the providers that I depend on a great deal is my massage therapist. I credit him for keeping me moving. And I have regular appointments with him. And if I miss them, I know I've missed them. So this is part of my routine. So I understand what it's like if you're an RN working now and you require, say, chiropractic services in order to maintain your back or your neck or whatever that might be to keep you working, and now you're missing that. As well, it also comes into play when we have members who may be off either on sick leave or workers' compensation, and they need these services in order to facilitate them going back to work. And of course, the longer that they're away from work, the more income that they're losing, because potentially if they're on workers' comp, or the more sick leave that they're losing. So we did raise this in our provincial meeting on Tuesday. We said and told the employer, and actually asked the message to go to the Department of Health. And, so that they look at when they're going to start to open up, in particular, the healthcare system, or open up businesses. And many of these, most of them are private businesses. Can they consider opening these businesses as a priority? Because we know this is really important for our members. And so we'll keep asking that question, but they did indicate, or, the individuals from the Department of Health who were on the call said they would bring that back to their planning session in terms of a consideration. So I just wanted to let you know that. Karen Noseworthy is our branch president from St. Clair's, had a comment last week and a question asking, we're seeing them limit workers from going from, site to site. And we, not since last week, but we are now seeing the employers put pretty well walls up around long-term care to try to limit access to long-term care. Yet we know that we have, even in acute care, staff moving from site to site. One example of that is dialysis in St. John's, that individuals might move from site to site. As well, my understanding, even dialysis outside St. John's, in Bonavista, for example, sometimes they need support from Clarenville in order to maintain the service in Bonavista. So this isn't just a St. John's phenomena. We do have people, even in acute care, that might be moving from one site to another. And we've, again, have raised this as a concern, and the movement of staff around, whether it be from unit to unit or site to site, was actually one of the concerns that we raised as soon as we started um, conversations with the employer and government around COVID-19, because we knew that one of the recommendations out of the SARS inquiry was that limits on staff movement were not put in place. And as a result of that, the virus moved from unit to unit and moved from facility to facility. So this again, we're still pressing the employer on this, and we've had some good conversations with the employer, and they're still trying to limit movement as much as they can. And sometimes, though, they have restrictions around capacity and types of patients and skill levels of staff, those types of things that have to be taken into consideration. But their objective is to limit as much movement as possible. And we'll keep asking those questions to make sure they're putting in as many restrictions as they can, so that we're protecting and isolating the risk as much as we can. So those were a few catch ups from last week, and I know there's a few questions coming in there now, so I'm keeping an eye on that. But I want to talk about a couple of the hot items that have happened since last week, and maybe one of the hottest items. I've mentioned long-term care. So as I said, they put walls up. Trying, because we know one of the riskiest populations, and I talked about this last week in terms of what was happening in long-term care in Quebec and Ontario, and we want to do everything we can to make sure that doesn't happen in our province. So limiting the staff is one way to do that. And every employer now has protocols or staffing plans in place. We know that there are challenges in RN staffing in some areas. And in fact, today we put a notice on my RNU, I believe, telling casuals that if we're working in acute care and aren't getting their hours, if you want to go to long-term care, who to contact, because they certainly are looking for additional staff. So I'd throw that out to any casual RNs who might be listening. And I lost my train of thought just on that. And I was talking about the walls around long-term care, and I totally lost what I was going to say. But that's okay. It might come back to me later on because I lost it. All right, let's just go on to another question because Debbie lost her train of thought. This is what happens when you do things by yourself and you go off script to the questions I have there. But anyway, yep, lost it. Okay, let's talk about N95 masks and personal protection equipment, because that's one of the questions here I have to cover, and that one I will not lose my train of thought. So I know there was information sent out on the weekend around the now, I don't want to call it reuse of N95s. It's the decontamination of N95s. And the employers sometimes are calling it sterilization. Sometimes they're calling it repurposing. And in our documentation that we've put out, we're calling it decontamination because we believe that's what it is. The employers got approval from Health Canada late last week that they can proceed with decontamination of N95s. In that approval from Health Canada, it was a limited approval. It was meant to be a short-term approval for COVID-19. There are restrictions that are placed on the decontamination that employers have to follow through on, which meant much of this was covered in the documentation that I believe most employers now have put out. So a couple of the restrictions are that the mask cannot be soiled or wet or damp. So if in order for it to be put in the process for decontamination. You get to choose as an RN whether your mask has been damaged at all. And if it has, then it would not be used for decontamination. The maximum number of times that the mask can be decontaminated is twice. And the mask is single user only. So you will use your mask, then it will be decontaminated, then you will get your mask back, you'll use it again, then you go through the process of putting it in a bag, it will be decontaminated, and you get it back, use it again, and then it's thrown out. So maximum of twice, and it's your own mask. So the way that they're going to track that is giving every RN a label, put their name on it, their employee ID number, their unit, that process. I'm not going to get into that a whole lot. And this will make sure by doing all that, tagging your mask, that you make sure you get back your same mask. This is, and I know the employer, or at least Eastern Health, when they sent out their original documentation on Saturday, left out a very important piece around decontamination of masks. And that is that this process will be used as a last resort. The preference will always be for us to get more N95 masks or a similar mask that will provide you with the same protection or a better protection even. That is still the priority, and that is still the commitment that we have from government and the RHAs. But we do know that there is a worldwide shortage of N95 masks. And this is a fallback should we find ourselves in the position where we do not have enough N95s should we need them. And if that happens, the decontamination will be a contingency plan. We have that commitment from the employers. We have that commitment from government. And I don't have any concerns that they're not going to honor that commitment. Health Canada has approved this process. The manufacturer has approved this process using a STERAD hydrogen peroxide sterilizer. It is a short-term solution, and it is a just-in-case solution. And I hope that we never, ever have to get there. Right now, the number of our cases are low. I think we've gone 4 or 5 days with 0 cases. All that is really optimistic, but we all know there could be a second wave coming, a surge coming that could come in months. Of course, that gives us more time to procure more N95 masks. So all that works in our favor, and we will hold them to their commitment that they are still working, and we know they're still working to source N95s, and that we will only use decontamination as a last resort. And we're not the only province that is looking at that. Alberta is doing the same thing. BC, all across the country, they're talking about this now because of the shortage of N95. And I didn't read the story, but I did see a brief headline on Twitter tonight in terms of the Prime Minister saying that there were planes that came back from China with no supplies because there were none to be had. And I didn't read the full story, but that was a scary story to me, and just reminds me that, yes, this is a real problem, and we need to have some contingency plans. Other contingency plans are using a different type of fitted respirator called a KN95, but we've also know that some of the supply that has come in from China have not been up to standard, so there's no guarantees, even if we get them, that we're going to be able to use them. Another type of mask that I talked about last week is the P100, which have reusable or disposable filters. They're sort of like an industrial half mask with round things here. They are continuing to procure as many of them as possible, and we know that they're using them in ORs and for those people who can't be fitted for an N95. So we're working, we're working on trying to get more of them. So there are other plans in place, but this is the absolute last resort fallback plan. Huge issue still around having to use sick leave when you're sent home with minor COVID symptoms. This has surfaced. We talked about this last week, and we know the issue is still ongoing. We've raised it with the employers and with government. We had a short conversation about it yesterday at our provincial call. I can tell you that I wasn't too happy with the response that we got back. It wasn't a definitive response. It was sort of adding a little bit more information. And I very forcefully, I guess you might want to say, voiced my displeasure with that and the amount of stress that this is causing, not just on our members, but all healthcare workers. I know we have people out there who do not have sick leave and are either having to take other types of leave, and some people don't have other types of leave, so therefore they're having to take unpaid leave. So this is a big problem. And you're having to stay home with very minor symptoms, a sniffle that you would absolutely work with any other time. But because of COVID, you're being told, no, you can't work. So this issue is not going away, and our pressure on government and the employers to address it is not going away. Based on our discussion yesterday, and your executive director, John Vivian, was just as upset as I was. So we, both of us, went at them on our video call, and we said we wanted a separate meeting set up with all the unions and with government and the employers just to talk about this issue, because it's not acceptable right now. When we negotiated the Good Neighbor Agreement and the leave provisions that were in it, we had no idea what this was going to look like. We had no idea what the impact would be and how the virus is changing, and that you could get negative swabs even if you're a positive, and then they'd want to have so many negative swabs before you could go back to work, and then the symptoms, the list would get longer for really minor. We had no idea about any of that when we negotiated that agreement. It was meant to be a fluid agreement that we could, either party could go back and have discussions around if things had changed. And this is absolutely something that has changed. So I know people are very frustrated. We hear your frustrations. We share your frustrations. And we are trying, and we will keep trying. And when I say we, I want to include all the public sector unions in this. We're all on the same page, and it is an issue for every single healthcare worker in our province. And actually, by my work at the Federation of Labor now, I know it's an issue for every single employer, unionized employer in the province, because I've heard it from other sectors as well. It's a real problem. So my commitment to you is we'll keep fighting on that issue, and we're not going to, we're going to keep pushing as much as we can, and we'll give you updates as soon as we can get them. Another question, and then I'm going to get to a couple of questions from the website. I got to remember to scroll down, right? So a question that's come up in the last week, someone asked whether the employer is going to cover travel time if you're deployed to another workplace. So say, for example, I'll just pick something out of thin air. If you work in St. John's and you're deployed to Carbonear, it takes you an hour to drive to Carbonear. So are they going to cover your travel time? Because you might live 5 minutes away from your normal site, but now you're going to extend your workday by an hour on each end. So we asked the employers to look at this yesterday, and we're hoping to get a response tomorrow. I have been told that one of our members who was redeployed or deployed, I don't know which word it is, but if one of our members who was supposed to be deployed in Central Health, she was told that her travel will be covered. I don't know if that's a sign of what's going to come provincially, but we should have an answer on that tomorrow. Still getting some questions on childcare being denied. And I'm not, and if that is happening, you need to make sure that you're using the process that is online on government's website, and that your employer should have knowledge of as well. And that would have gone out to them late last week. So all that should be available now with your employer. So if you're an RN and your husband or your partner is working from home and they work, say, within healthcare, for example, then your employer, and say you have the same employer, you both work for Eastern Health. Well, Eastern Health would be able to provide the documentation that your partner is essential and is working from home. But if your partner works for a private sector employer, then that individual, your partner, needs to get documentation from their employer saying that they're essential and they're required to work from home, because that needs to go in with your application. So those are a couple of new steps that have been added that people might not be aware of. If you're denied, reply to your email of denial and go back and ask them what's the rationale for denial. And if you're still denied, reach out to one of your labor relations or your assigned labor relations officer, and we'll see if we can work through some of those issues. I mean, this is an exception for healthcare workers. So not every essential worker in the public sector has access to in-home childcare and in-home childcare if your partner's working from home. So we are trying to work through those things on a case-by-case basis. I see a question online from Leslie Hines, and Leslie asks, have I heard anything about postponement of annual leave until August? No, we have not heard that. The Good Neighbour Agreement, the posting of annual leave was delayed until June 1st. Under the collective agreement, it should have been May 1st. So we agreed to a June 1st date. And we haven't heard anything yet, or anything that date will not be honored. We certainly know that depending on where we are with the system, they might come to us at any point in time and saying we need to move that date. But at this point in time, as far as we know, it's June 1st. So if I hear anything else, we will make sure we post it to my RNU. Okay, so another question was around, should I be wearing or taking my work shoes home? And what about if I'm dressed in PPE? So under the CFNU position statement, it actually talks about the importance of your point of care risk assessment, obviously. I mean, that is our foundation in terms of determining what PPE that you need. And I can't stress that enough, that, you have, every one of our members has tremendous knowledge. You use your knowledge and your judgment, your nursing judgment, every single day before COVID, and you'll use it again after COVID. So it's you have to look at the patient and the situation before you to make a decision around what personal protection equipment that you need. If you feel that you need a head covering, and I know some of our members are wearing them anyway, they feel more comfortable. At a minimum, you got to have your hair up. We should have our hair up anyway, but having your hair down like this in your face is not a good thing to have on a good day. Certainly not a good thing to have if you're working with COVID patients. So get your hair up off your neck and out of your face. Number one priority. If you want to wear a hair covering, why not? It's a bit of extra protection. Put something on your head, whatever it is. It doesn't have to look good. It could be an OR hat if you think that you need it. And again, do your assessment. Make the decision. If you've got a patient who is coughing a lot and expectorating a lot of phlegm or whatever, well, then maybe you should make sure you have your hair covered. So do your risk assessment, your point of care risk assessment. In terms of your footwear, there has been, I don't know if there's more than one study, but there certainly has been a study to show that the virus can be found on the bottom of footwear. Now, as the Department of Health pointed out to me, because I asked this question about, what should we be doing about footwear? Should we be telling people not to take them home? Should we be cleaning them? Those types of things. As they pointed out to me, your feet are really far away from your hands and your mouth and your nose and your eyes, which are all areas where the virus can enter. And yes, most of us are not putting our hands on the bottom of our shoes to take the virus to our face. So there is very low risk from the virus moving from the bottom of your soles to your face. But in saying that, my recommendation to you, and I know how stressed our members are around the potential of taking this virus home to your family. So leave your work shoes at work. I know some areas are wiping down their shoes. Good for you. Take a disinfectant wipe, a shift, and wipe them down. Get the virus off them. If it's there, wipe them down. But then leave them at work. Don't take anything home from work that you don't need to take home. I'm hearing, for example, all people are taking in now are their name tags and their phone. That's all they're bringing to work. And then when they're leaving, they're wiping all that down. And as soon as they get home, they're wiping all that down. They're very careful around that. And that is what. So don't wear your shoes home. Don't bring them home. Leave them at work. Wipe them down with a wipe to make sure you're cleaning them. And make sure you're doing very, very good hand washing after you do that. Of course, that is the cornerstone of making sure that we don't pass on this virus. Okay, so I just had a question from Donna, and she said, what about people who had summer leave for May? And really good question, Donna. We just had this conversation with the employers in our meeting yesterday. And depending on, the employer said that they would like to, if possible, grant some annual leave between now and June. They know they have requests in. Of course, a lot of that is going to depend on whether we keep our numbers down and if we get the surge and those types of things. And essentially, we said to the employer that you treat the time from now till the 1st of June just like any other annual leave outside of the summer period. So however you determine giving people annual leave, in February, then really that now extends until the 1st of June because we've moved that date from May 1st to the 1st of June. So there's no commitment from the employer that they're going to be able to do it or do it. And of course, that certainly depends on how well we do with COVID. But I believe that there is also a recognition by the employers is that, people need off. When we look at the projections and where we might be, and that, if there's a second wave and those types of things, the importance of trying to give people a break and some time off would be really valuable. But things are still pretty tenuous. So I'm hopeful that maybe some leave can be given, but it is very much dependent on how well we do in terms of keeping the COVID at bay. One of the things also we know, and people might have requests in for annual leave that they might not want anymore because of the restrictions around travel. And I think Air Canada now is not going to travel to the States for a while. So, there's all that uncertainty right now in terms of individuals that might have leave in between May and June. What else in terms of a question? I can't remember how I lost my train of thought earlier around putting the walls up, but anyway, that might come back to me at some point in time. Someone asked about hazard pay. I know I talked about this in my first Facebook Live, and maybe someone is asking the question again, and I cover that off. And then someone else has another question about a temp position extending, and then maybe I'll finish up for tonight. Hazard pay is not something that we've looked at. We have been not totally focused, but certainly very focused on making sure that our members have the appropriate personal protection equipment. Because if you have that, it decreases the hazard or eliminates the hazard if you have the right equipment. And as registered nurses and NPs, we go to work every day and we face many, many hazards. This is just one. We face the hazard of violence. We face hazards of other infectious illnesses such as tuberculosis. I remember, and this, I thought a lot about this topic because it's up a few times, and I went back to my earlier years when I was practicing frontline nursing in the 80s, when AIDS was a new virus, a brand new virus. And it was deadly. There was no treatment. There was no cure. Everybody was frightened of who might have the virus. And our defense against the virus was around how do we protect ourselves from it? We can't stop the patients right now from having the virus. So how do we stop us from getting it? And by putting in universal precautions and treating every single patient like they had HIV in terms of blood and body fluid precautions, which now are just second nature to us. But back then, that was huge. And that was our way of diminishing the hazard. And we have to do the same with COVID-19. Next year, it might be COVID-21. Or it might be something else. There will always be a new hazard that enters our system. And our priority as your union is to make sure that you have an environment that's safe to work in. There was a question from an RN related to if an RN is currently in a temporary full-time position that is ending soon, will the manager be able to extend that temp position without consent of the RN? If this is the case, how long will the manager be able to extend the position? Well, now, isn't that a good labor relations question, which Debbie Forward is probably not even going to hazard a guess in terms of what the right answer is. I will give some context around it, though, in that it's a very challenging time to do any recruitment and retention. Hats off to the employers in that they're moving full steam ahead with hiring new grads. They're supposed to start on the 4th of May. They've set up orientation so they can have physical distancing, because we need our new grads in the system, and we need them to be orientated in case we get to a second wave of the virus. And we have many areas in the province who are just desperate for staff. Bonavista, Stephenville, Goose Bay, many areas right now are just stressed to the max. And the only way that some of these areas are surviving is because occupancy is down. So some recruitment is happening. So on this specific issue, I mean, there's no doubt that the Good Neighbor Agreement does give, pretty good latitude to the employers around making decisions in the emergency that normally would not be decisions that would be made. So this is probably a question better answered by a labor relations officer. So what I'll do, my commitment to you, is I'll make sure that someone is able to contact you and have a more fulsome discussion around that issue. And some of that also around the recruitment and the challenges around that. I mean, I know, for example, in long-term care now, with putting walls up and wanting to make sure there are staff available for long-term care, they might be looking at saying someone, say, for example, who got a job somewhere else, they might be saying, sorry, we can't let you go now because if we lose you, we don't have enough staff. So those things are happening, and usually we have discussion around them on a case-by-case basis. And we have to be, one of the spirit and intent of the Good Neighbor Agreement was around this is a crisis and it is an emergency, and things that normally, just would not be acceptable, have to be acceptable now because of the circumstances that we're in. In saying that, we've done really well. I know, we've had a number of deaths, and we still have a number of people who are sick and quite sick. But our province, and I want to say cross my fingers, but it has nothing to do with crossing your fingers. It has to do with people in our province who've really heeded the recommendations around staying home. And social distancing and washing our hands and doing all those things, which is really, right now, it seems like we've really not just flattened the curve, we've beat that down with a vengeance. And let's just hope that that continues for the next few weeks. And because that will be really positive news for everyone in our province. So I'm hearing also another questions around why do some places have scrubs and not others? And this is also a question we asked the regional health authorities, and quite frankly, there is no rhyme nor reason to why one place has it and not another. It doesn't seem to be an employer-wide policy that they're giving scrubs to, say, emergency and COVID unit, and the areas that would be more likely to have to care for COVID patients. It's sort of the trend we're seeing, but it's not consistent. Labrador Grenfell told us on a call last week that they've ordered scrubs for all their ICUs and their COVID unit, whatever. And I went, okay, that's nice. But then we have in other employers, saying, well, we got it here or we don't have it there. And there really isn't a, coordinated plan. It's just the way it worked out. So we will follow up on that one, because I understand that is a bit frustrating when you're seeing your colleagues who are working in the same type area as you, and they're provided scrubs, which is perceived, whether real or not, is perceived as an extra layer of protection. You don't have to bring your uniforms home to wash, which I know is a concern. So we'll raise it once again with the employers and see if you can get some consistency around that. I don't have any guarantees on that because it's also linked to supply and ability to launder, which is in some of our smaller places. But our recommendation around that is you not wear your uniform home. You change when you get to work, and you change before you leave work, and you put your uniform in a washable bag. Someone recommended on our Facebook Live a couple of weeks ago, pillowcase works awesome. So bring a pillowcase, put your uniform in that, take it home, throw it in the washer, and your uniform will be fine, and you don't have to worry about the virus spreading from your uniform. So another question from Colleen asking, when are RNs going to be allowed to wear N95s for swabbing? Right now, our position is that every RN should do a point of care risk assessment for the patients that they're coming into contact with. And that includes whether you're swabbing in the home, whether you're swabbing in one of the, what I call drive-through assessment units. It's if you're caring for a patient in eMERGE or on the COVID unit, your first action should be doing that point of care risk assessment. And that is looking at things like taking into account the patient that is in front of you and what the symptoms and issues the patient is presenting with, the environment that you're in terms of the risks that may present, as well as the task that you have to do. Those are sort of the three standard things that you should do in terms of a point of care risk assessment for occupational health and safety. And if, after you do your assessment, if you believe that you should be wearing a fit tested respirator, you should ask for a fit tested respirator. The agreement in principle that we have with the Department of Health is that the access to an N95 respirator will not be unreasonably denied if your point of care risk assessment deems that is a piece of your PPE that you should be wearing. Agreement is not signed yet. It's been a bit of a struggle getting the I's dotted and the T's crossed. But the minister has said, this is our agreement. So, if you believe you need an N95, then I would be asking for an N95. I'd feel more comfortable about that once the agreement is signed. But certainly, even right now, we've said to our members, if you think you need to wear an N95, you go to your manager and you say, based on my risk assessment of whatever that was, I want to wear an N95 for this patient. And if your manager refuses, then you have a right to refuse on safe work. And we know many of our members have done that. We also know there are many of our members who are doing swabbing in certain areas where they're comfortable in, based on their point of care risk assessment, that they're comfortable in using a shield and a surgical mask. So it is, very individual for the patient that is presenting before you, the environment that you're being placed in, and the task you have to do. So that is a decision that you need to make. I go back to, my comments earlier around the decontamination of N95 masks. I would like nothing else, and the supply issue, in that there is a worldwide shortage of N95 masks. And that is a reality that is true. It's real. It's very real. And I would like nothing else, and then to say to every RN, look, just use an N95 for everything. But in reality, supply is an issue, and I depend and trust, and this is what I do every day is around assessing your patients and for their needs, your needs, protecting yourself. And you need to still trust your judgment, do your point of care risk assessment, and make your decision. Um, and um, and then act on that as the patient presents. Um, so another comment by someone is not available, that masks aren't available. So what's the point to me using my judgment? And that certainly is a significant concern. If there isn't an N95 available, I would be talking to your manager and having some available, because even if you're doing the assessment unit drive-throughs, or you're working in urge, I mean, there's lots of reasons why you might need to don an N95, not just for COVID. It could be another infectious respiratory airborne, and in particular, I'm thinking about TB, because TB is an airborne bacteria, and you need to wear an N95 mask. It is quite frustrating, I understand, when you feel like your judgment isn't being acknowledged. And that was, my argument, and still my argument with the Department of Health, and around, look, we trust RNs and NPs and physicians to make judgments every single day, and we don't question saying, no, you can't do that. We're not going to depend on your clinical judgment and your knowledge, but yet we do it every single day, saving lives. But you don't think we can make an assessment in terms of what type of mask we need to wear for this particular patient in this environment, doing this nursing care or this task. And you know what? It really comes back to you, and you having to make a decision about your own safety. And I can't make that for you. No one can make that for you. You need to make it based on your own assessment. And if you feel that you shouldn't do this without an N95 mask, then you have the right to stop the task and ask for one. And we put that advice out to our members several weeks ago now, so that documentation is online. So you might want to read it and refresh yourself. As soon as we get our joint statement signed, I think it will, I hope it will provide more clarity to RNs, and in particular to, I think there is clarity that needs to be provided to frontline managers as well. So we're working on that part of it in terms of what this statement means in the real world. So it's now, believe it or not, it's 9:00. And I usually try to end these at 40 minutes. And where did that time go? Well, as you know, I can just talk. It's one of the things I do best. So I'm going to end it here tonight. My commitment to you is that every Wednesday we'll do a Facebook Live. Someone just said she loves my background in my living room. Thank you very much, Sandra. The first night I did this, I even took all my artwork down, so I had a bare wall behind me, because that's what all the videos online said to do, is don't have anything behind you. And it was so boring. I said, okay, I'm not doing that anymore. So now I'm just got to figure out every Wednesday night, what other view can I have of my house, so you can see where I live and whatever. But thank you very much for that really nice comment. So back again. I want to thank you, every single one of you, for all the amazing work that you're doing. I know it's very stressful times. I'm here in my little bubble in my house. I'm missing my kids. I'm missing my granddaughter. I drop things off to not my mother, and don't see her. You go and get it when I'm down, trying to be from anything. stressful, but it is compared to, I know that you take to work every single day, and the concern they have around this virus, and the waiting. The waiting is almost unbearable. It's almost unbearable to me in terms of when is it coming? Is it coming? When is the big coming? I can't imagine what it feels like to be in the system and just waiting. That must be a tremendous stress on your shoulders. Make sure you practice some self-care. It's really, really important. The psychological and emotional strain that this is having on all of us, and in particular you, in the healthcare system is tremendous. And it's everyone. It's our RNs who are working on very busy medicine units, who are working in mental health, who are working, in long-term care and community. It doesn't matter where you're working. It's the mental stress of this is tremendous. Then you lay on top of that busy units, so the physical stress of very physical and very sick people. It's a lot. It's a lot to handle. So mental health, do some little things to look after yourself. Take 5 minutes, take 10 minutes, lock yourself in your bathroom, have a walk, even if it's just to get outside and feel the sun on your face for 10 minutes. Read a book, listen to some music, do a puzzle, whatever makes you relax or helps you relax. Make sure you take some time to do that, and encourage the same for your family, who are very scared for you and very worried about you. And I know you're putting on this great big brave face, telling them that everything is going to be okay, and it will be. But scared to sure you encourage them and self as well. So thank you for joining me tonight. I really appreciate it. I got a little bit better of watching the comments, so that's good. I was able to answer some questions that came in our feed tonight with the help of our communication specialist. I was cheating a little bit. I had my phone, and if I couldn't keep track of them on the feed, she would be texting me. So I cheated a little bit, but I'm allowed. Thank you very much, everyone. Remember to think of our friends and neighbors in Nova Scotia, and I know that you would. Put some blue ribbons on a tree outside if you can. And thank you very much for joining me, and I'll talk to you again on next Wednesday night. Good night, everyone.